Hi everyone, welcome back. Today I will be talking about Medicare final rule for durable medical equipment, prosthetics, orthotics, and supplies. Let's dive right in. On December 21st of 2021, the Centers for Medicare and Medicaid Services or CMS issued a final rule that furthers the agency's commitment to strengthen Medicare by expanding access to certain durable medical equipment such as continuous glucose monitors that increase diabetes treatment choices for people with Medicare. The durable medical equipment, prosthetics, orthotics, and supplies or DMEPOS final rule aligns with the key goals of the administration to create a healthcare system that results in better accessibility, quality, affordability, empowerment, and innovation. These regulations are effective on February 28, 2022. DMEPOS fee schedule adjustments. This final rule establishes the methodologies for adjusting the fee schedule payment amounts for DMEPOS items furnished in non-competitive bidding areas or non-CBAs on or after the effective date of the rule or the date immediately following the duration of the COVID-19 public health emergency or PHE, whichever is later, using the information from the DMEPOS Competitive Bidding Program or CBP. CMS will continue paying suppliers the 50-50 blend of adjusted and unadjusted fee schedule rates for furnishing items and services in rural and non-contiguous areas. These rates were informed by stakeholder input. Stakeholders have highlighted certain higher costs and greater travel distances in certain non-competitive bidding areas compared to competitive bidding areas. The unique logistical challenges and costs of furnishing items to beneficiaries in the non-contiguous areas, the significantly lower volume of items furnished in these areas versus competitive bidding areas, and concerns about financial incentives for suppliers in surrounding urban areas to continue including outlying rural areas in their service areas. CMS will continue to monitor payments in rural and non-contiguous areas and all non-competitive bidding areas, as well as health outcomes, assignment rates, and other information, and may also consider their payment methodologies toward DMEPOS items and services furnished in rural and non-contiguous areas and non-competitive bidding areas in the context of any future changes to the DMEPOS competitive bidding program. For contiguous non-rural areas, CMS will be paying suppliers 100% of the adjusted fee schedule rates using information from the DMEPOS competitive bidding program. For the former competitive bidding areas, CMS will be paying the single payment amounts or SPAs established during DMEPOS competitive bidding program, updated by an inflation adjustment factor on an annual basis. Of note, since 2019, when the gap in the DMEPOS competitive bidding program first began, CMS has been incorporating into these fee schedule rates an update based on changes in the Consumer Price Index for all urban consumers. These past annual updates have not included any percentage declines, and the update for 2022 will be at least 5% for all areas. For 2022, the former competitive bidding areas will receive a 5% update, and the non-competitive bidding area blended fees will receive between 5.1%, the unadjusted fee update, and 5.4%, the adjusted fee update. This final rule does not change these already existing payment methodologies found under the Code of Federal Regulations, Part 414, Section 210, Paragraph G4, and Part 414, Section 210, Paragraph G10. Now let's talk about DMEPOS fee schedule adjustments for items and services furnished in rural areas from June 2018 through December 2018, and exclusion of infusion drugs from the DMEPOS competitive bidding program. This final rule finalizes and addresses public comments received on the May 11th of 2018 interim final rule entitled Medicare Program Durable Medical Equipment Fee Schedule Adjustments to resume the transitional 50-50 blended rates to provide relief in rural areas and non-contiguous areas. Specifically, this rule finalizes provisions related to implementation of Section 16007A of the 21st Century Cures Act, as well as the increased payments in rural and non-contiguous areas made from June 2018 through December 2018. In addition, CMS is finalizing conforming technical changes to the regulations text to exclude infusion drugs from the DMEPOS competitive bidding program. DME interim pricing in the CARES Act. This final rule finalizes and addresses public comments received on the May 2020 COVID-19 interim final rule with comment period section titled DME interim pricing in the CARES Act. Specifically, this rule finalizes conforming changes to Part 414, Section 210, Paragraph G9, consistent with Section 3712 of the Coronavirus Aid, Relief and Economic Security Act or CARES Act, which revises the fee schedule amounts for certain DMEPOS items and services furnished during the COVID-19 public health emergency using a blend of fee schedule amounts adjusted using information from the DMEPOS competitive bidding program and unadjusted fee schedule amounts. Section 3712A of the CARES Act mandates that the fee schedule amounts for certain items furnished in rural and non-contiguous, non-competitive bidding areas be based on a 50-50 blend of adjusted and unadjusted fee schedule amounts through the duration of the public health emergency, and Section 3712B of the CARES Act mandates that the fee schedule amounts for these same items furnished in all other non-competitive bidding areas be based on a 75-25 blend of adjusted and unadjusted fee schedule amounts through the duration of the public health emergency. This final rule establishes procedures for making benefit category determinations and payment determinations for new DMEPOS, therapeutic shoes and inserts, surgical dressings or splints, casts, and other devices used for reductions of fractures and dislocations under Medicare Part B that permit public consultation through public meetings. CMS has established procedures for coding and payment determinations for new DMEPOS under Medicare Part B that permit public consultation in a manner consistent with the procedures established for implementing coding modifications for ICD-9-CM, which has since been replaced with ICD-10-CM as of October 1, 2015, in accordance with Section 531B of the Medicare, Medicaid, and State Children's Health Insurance Program Benefits Improvement and Protection Act of 2000. CMS started using these procedures for Healthcare Common Procedure Coding System or HCPCS Level 2 code requests for items and services other than DME in 2005. Let's talk about classification and payment for continuous glucose monitors under Medicare Part B. This final rule classifies adjunctive continuous glucose monitors or CGMs under the Medicare Part B benefit for DME. However, CMS is not finalizing the proposed categories of supplies and accessories and fee schedule amounts for three types of continuous glucose monitor systems. After consideration of public comments, CMS does not believe it is necessary at this time to further stratify the types of CGMs beyond the two categories of non-adjunctive and adjunctive continuous glucose monitors. The fee schedule amounts for the newly covered adjunctive continuous glucose monitors and related supplies and accessories will be established in accordance with existing regulations for establishing fee schedule amounts for new DME items and services without a fee schedule pricing history at Title 42 Code of Federal Regulation Part 414 Section 238 Paragraph B. HCPCS Level 2 code application process and expanded classification of external infusion pumps as DME. For the reasons described below, CMS is not finalizing its proposals regarding the submission and evaluation of Healthcare Common Procedure Coding System or HCPCS Level 2 code applications and the proposed revision to their interpretation of the appropriate for use in the home requirement in the definition of DME as it applies to certain external infusion pumps. CMS found it unnecessary to adopt the HCPCS Level 2 proposal as CMS has already made several administrative changes to the Healthcare Common Procedure Coding System or HCPCS Level 2 editorial process that have improved the process and addressed many of the issues discussed in the proposed rule. With respect to their proposal related to external infusion pumps, many commenters believe that the proposal to expand classification of external infusion pumps as DME was unclear, needed more development, and raised safety concerns related to decisions regarding what drug therapies could safely be administered in a home/non-facility setting, as well as concerns about cost sharing and cost shifting to beneficiaries. After considering the public comments, CMS is not finalizing the proposed expanded classification of external infusion pumps as DME policy. This is the end of my presentation. Hope this video provided you some value. If you enjoyed this video, please consider subscribing to my channel. Thank you for watching. Hope to see you next time.